a really important and emotional moment for me personally and for our institution. I am so pleased to bring you all today from Sudbury at our campus. My name is Dr. Sarita Verma, and I'm the president, vice chancellor, dean, and CEO of the Northern Ontario School of Medicine University, LEMNO, Université de LEMNO, as it's known. Um, I first want to open with a territory acknowledgement. With great humility and respect, I would like you to acknowledge that for those of us here who are settlers, and where you are, of course, anywhere else, that here we live truth and reconciliation. We have it within our beliefs and our true dedication to achieving truth and reconciliation with the First Nations and Métis people. Here in Sudbury, we are on the traditional lands of the Atikameksheng and Wanapate First Nation, but we have a campus that's all over Northern Ontario, and in fact, our other larger campus in Thunder Bay is on the traditional lands of the Fort William First Nation. And in that spirit, I can tell you that today is one of the most amazing moments for us thinking about truth and reconciliation and where we are, honoring the wisdom and the wonderful legacy that has been left to us by Indigenous partners, Indigenous settlers, and as you will see around here, the commitment we have to social accountability for Indigenous and Francophone populations, which are the populations that we serve. For us, it is a culture of mutual respect and trust. And today is an incredible day for health equity in Northern Ontario, and in fact for Canada and for the world, because I am pleased today to launch the opening of the first interdisciplinary research center for health equity, the Dr. Gilles Arcand Center for Health Equity at NOSM University. Dr. Gilles Arcand, Centre de Santé de l'Équité, is really a momentous dream come true for us. The center is truly one of a kind, and to my knowledge, there is no other center like this in Canada or in the world. We are part of a connection to the Towards Unity for Health social accountability network, and deeply embedded within social accountability is the concept of health equity, addressing les inéquités dans la santé, addressing the determinants of health, which in Northern Ontario are worse than they are in any other part of Canada. We have almost 5 times the amount of mental health and addictions here. We have very significant chronic disease. We have a deep problem with food security, water security, personal security, the legacy of residential schools, and the post-intergenerational trauma here is profound. And although we can address these issues here in Northern Ontario, the impact of the Dr. Gilles Arcand Center for Health Equity will not stop in the North. I have no doubt that our researchers who have come to lead internationally, you will meet some of them today, are actually challenging the realities of healthcare delivery in rural, remote, Northern, and Indigenous and Francophone populations. And they're speaking up. They are not shy. They are really, truly speaking up, and they are making a difference that will have an impact on how health service is delivered, what happens when we treat disease, how we help the homeless in every population of Canada and in the world, and how we address the status quo. We are going to challenge the status quo, which we do at NOSM University, Université de LEMNO, every day. The world will look to this center for a blueprint on health equity. The work here cannot be done without the wonderful support of the Temerty Foundation. They are here with us today virtually. I cannot tell you how blessed I feel to know these people, Mr. James Temerty, Mrs. Louise Temerty, and of course, Leah Temedy Lord, who is the manager of their foundation. It is really a great gift for me to have got to know these individuals. Their kindness, their generosity, their thoughtfulness is unparalleled. And for Northern Ontario, I want to tell you this to the Temedy Foundation and to your family. Merci beaucoup. Thank you so much, Miigwech. It is truly the transformative gift that you provided to us. $10 million. $10 million gift. That's one of the largest gifts that Nazim University, Université de Lemno, has ever received. Our fledgling little university. Our fledgling university is actually only 2 years old. Prior to that, we were a medical school, and we will, as a medical school, be 20 years old. But we have been having an immense impact in Northern Ontario. We've had a large 55% of our class choosing family medicine, which is in dire need in Canada. We have almost 90% of our students, if they stay to do residency, stay in Northern Ontario. And with our help, actually, over 400,000 people now have healthcare because of the work of our institution, Canada's only independent medical university. So thank you so much for your amazing gift and your support. Imagine what you have done. Imagine the impact you will have on people's lives. Imagine, beyond imagination, today standing before you are researchers and our workers at the Dr. Gilles Arcand Center for Health Equity, who will be able to actually deliver on the legacy of that great man. That man was the brother of Louise Temedy and was a humble, kind, thoughtful man who delivered healthcare in northern Quebec to les Autochtones, the indigenous people. He died tragically and suddenly in an unexpected death. And it is in his legacy that this center is named. Thank you again for allowing us to honor him. With that, I would like to turn over to Mrs. Louise Temedy, who would like to say a few words in her brother's behalf. Thank you. Over to you, Louise.
Merci, Docteur Bernard, pour cette belle introduction. Je suis enchantée d'avoir cette connexion avec mon frère Gilles. After completing his residency in Montreal, Gilles went to work at the hospital in Chibougamau. For 3 years, he dedicated himself to treating the townspeople and the First Nations. Sadly, Gilles passed away in a tragic plane crash while en route to work with Chuso in Peru. He was only 33 years old. I am certain that if Gilles were with us today, he would be honored to have his name associated with NOSUM and the exceptional work you do for our rural, remote, and northern communities. Gilles adorait son travail et vivre à Chibougamau. Un sportif, il excellait dans tous les sports que le Nord pouvait lui offrir. Through the Dr. Gilles Arcand Centre for Health Equity at NOSUM, I am grateful that his memory will live forever. Thank you.
Merci, Louise. Merci, Leah. Merci, Jim, and to the foundation for your gift of love. It is truly coming from your heart. And merci, Dr. Gilles Arcand, for giving us this legacy. We will aspire to live up to your ideals and your values. I am very pleased to announce Dr. Erin Cameron, PhD. She is the academic director, the inaugural academic director of the Dr. Gilles Arcand Center for Health Equity, and she has a few words to share with you about what the center does and will do.
Thank you so much. It's such an honor to be here and also to receive this gift and just hearing your words, Louise, about, again, the legacy and the work now that we're committed to doing. So you've heard from Dr. Verma about the uniqueness of the center. You've heard about the heart, the love, again, from the Temerity Foundation to be able to help us realize the commitment towards health equity. As the director of the Dr. Gilles Arcand Center for Health Equity, I am incredibly grateful for this gift and for the opportunity to really help to move the needle on health equity. I'm grateful to all of you for being here to share this day with us, because it is an incredible day, an incredible start to this center, to this space. I would like to actually have another round of applause for this space, this incredible space that we are standing in today of the murals. So thank you to show your support today. I'm also very grateful for my leadership team, to those and the staff of the center who are here with us today. I want to acknowledge them in name, so please lift your name, lift your hand. I'd like to recognize Dr. Brianne Wood, Dr. Barb Zellick, Dr. Joseph Leblanc, Dr. Alex Anawati, and Dr. Jessica Yurgudis. These are the leadership team of the Dr. Gilles Arcand Center, and they are here because they made today possible. There are many others to thank, and we will thank them as we go forward. Now, I would like to paint a further picture to what Dr. Verma started to share. Despite the significant successes already that we are starting to see with the center, we need to move the needle further on health equity. There continues to be a crisis in terms of the numbers of physicians and healthcare practitioners in northern, rural, remote, Indigenous, and Francophone communities. The healthcare care needs of northern populations are complex. Having the most vulnerable, unhealthy populations of any geography in Ontario. We have the highest rates in the province for addictions, mental health, cardiac disease, cancer, and diabetes. We also have an aging population and a life expectancy that is on average 2 years lower than the rest of the province, and a high number of far north and remote First Nation communities who face food insecurity, long-standing boil advisories, and high rates of chronic diseases. But it's all not gloom and doom. We also have many strengths. In Northern Ontario, we have resilience. We have resourcefulness and creativity like no other, like many of you in this room know. We have incredible strong community connections and community spirit that offer place-based approaches and solutions. We have different challenges that require different kinds of research questions and I'm proud to say that we have incredible talent, expertise, and collective fortitude to tackle these wicked challenges together. The many of you in this room are those who will be doing this collectively together. The why of the center is what we are deeply committed to reducing health inequities, and we are grounded in our collective strengths. Those of you in this room and those listening online, and thank you again for this generous gift to be able to start to work together on this incredible challenge. The center is serving as a home for researchers and emerging research networks. We are up to 10 research networks, helping to grow that in the North. We take an embedded networked approach to working together for solving problems. We know that is not one person, not one institution, but collective. We need to work collectively together to build a stronger North. To conclude, to me, this is an exciting time. It's just the beginning of our collective work. We believe the magic is in talking together, walking together, and working together. This new space is just the beginning. We will serve as a gathering place for community-based research for many months, years, and decades to come. Again, we are incredibly grateful for this gift. Thank you. For those who would like to learn more, there's lots of things in the hallways to learn about what we're doing. Please visit our website. But most of all, please reach out. We want to hear from you. Together, we will move the needle on health equity. Thank you.
Bonjour, bienvenue tous à toutes. Je m'appelle David Marsh. I'm David Marsh. I'm the Vice President, Research and Graduate Studies here at Malcolm University. And I'd just like to take this opportunity to join with Dr. Verma and Dr. Cameron in thanking the Temerity Foundation for their generosity and to say a couple of brief words about the center, to highlight some aspects that have not yet been touched on. I think our goal in research at NASUM University is to strengthen the research capacity in the North by aligning our health research partners to improve performance and measurable outcomes, to have a positive impact on the communities of Northern Ontario that we serve. And the Dr. Gilles Arcand Center is now positioned to really catalyze that type of research growth. One way in which the Gilles Arcand Center will be unique and different is its capacity to bring together not just researchers, but researchers and students and policymakers and people in communities who are impacted by the health conditions that we're trying to address, so that we collectively can bring different perspectives and find new solutions. I'd also like to mention that the investment of the Temerty Foundation in this center is already producing opportunities for further investment in research. For example, Dr. Cameron has led a team that received a large grant from the Social Studies and Health and Humanities and Research Council, SHRC, over $3 million to support an international network of research related to social accountability. And this is just the beginning of the knock-on effects that this important foundational investment in the center will have. So we're extremely grateful to the Temerty Foundation for making all of this possible, and I'm grateful to all of you for coming out today. So I'd like to turn it back to Dr. Berman.
Chère Louise, see what you've started? You have started a movement, the Dr. Gilles Arcand Center for Health Equity movement for health equity, not just in Northern Ontario, but for the world. Here's the thing, you know this. We are facing so much strife in this world. We know that you are personally, your family is personally affected by the war in the Ukraine. And we stand with you as that is continuing to be a challenge for the world. We see so much poverty in the world. And all of that actually leads to refugee movements and homelessness. We see in Northern Ontario homelessness as a big determinant of what is happening. And if we have a chance sometime to have you talk with Alex Anawati and Joseph LeBlanc and Brianne Wood and the other researchers here, they are looking at how to solve that problem, because homeless people, they have no home, but they have no hope. And you're going to give us hope, Louise. Thank you. Jim, Louise, Leah, merci beaucoup. It is really with tremendous, tremendous affection. As I head into retirement, I can say this is the last thing I'm doing. And it is truly, truly a real pleasure to be able to acknowledge your gift. I am going to send to you in the mail, because unless we get to come to see you in Toronto, this stethoscope, I hope that, you know, we can actually have it framed. It does say Arcand and it does say NASM U on it. It is a beaded stethoscope. Our graduates from our Indigenous programs receive a beaded stethoscope. I don't know if you can see this. And the beaded stethoscope is very meaningful to us for our graduates. It is very unique, and it is beaded by local beaders. Beading is a real practice in Indigenous culture, and we wanted you to have it so that it is a gift from us to acknowledge the depth of the cultural competency and commitment here. So for now, this partially ends the service, because we do want to go outside and reveal the sign, which we had hoped we would do. But since you're not here with us in person, we hope you will not get seasick as we take the laptop outside or the iPad outside. It's very cold, by the way, so you're actually better off being where you are. You can see it now. So I think we're all going to go outside, if you would bear with us and stay with us. And then after the sign has been revealed, that will conclude our ceremonies. But give us a few minutes and walk with us as we go to reveal the sign.
Oh,
Everyone's coming out.
here we go.
Everybody. Ladies and gentlemen, let me present to you the first interdisciplinary research center for Northern University, l'Université de l'Ebno. Dr. Gilles Arcand, Centre de Santé et d'Équité. Dr. Gilles Arcand, Center to the Temerity Foundation, to Jim, Louise, Leah. Thank you for being with us today. Someday we will bring you to Northern Ontario and we will have a feast in your honor. Merci beaucoup. Thank you so much. Have a wonderful, what's left of obviously a beautiful week. And we will be signing off now. This concludes our ceremony. Thank you so
Thank
much.
you.
Thank you
Thank
so
you so
much,
much.
Dr. Verma,
It
and
was
an
a great
awesome.
ceremony. Thank you.
Thank you.
Thank you so much.
We can't wait to see it in person. This looks great.